I became a physician because it was important to me to continue the work that I had in science and to help people. I have a laboratory where we study the biophysics of sickle cell disease. I care for patients as an anesthesiologist. I grew up about 3 miles south of the University of Chicago, and one of the things I wanted to do is to try to stay in a community where I could help those people who had difficulties accessing health care and perceiving that health care wasn't really meant for them. It was Ron Davis of the American Medical Association, the late Ron Davis, who recruited me to the AMA when I was a first-year student in medical school. The AMAFoundation is extraordinarily important to the careers of students. The debt level in medical school now represents such an impediment that some students from disadvantaged backgrounds won't even consider going into a career in medicine because the resources don't exist in their family to be able to pay for something that's going to be that expensive. My original work with the foundation was through giving. I later became involved through my work with the Minority Affairs Consortium. Pfizer donated a fair amount of money to the American Medical Association Foundation in order to sponsor something that's called the Minority Scholars Program. I was asked to be a member of the selection group, and the staff of the American Medical Association Foundation was very encouraging and asked me again to help them in another one of the programs. The Excellence in Medicine program is just fascinating for me to participate in. First of all, it's a great honor to be able to select physicians who dedicate their entire lives to their passion in medicine. And we've seen people in their 90s who are still contributing to the care of others, often at no compensation to themselves. I actually use the stories of these physicians to talk to my residents and my medical students about what their role in medicine should be in society. And when they hear about the exploits of some of the students in the Minority Scholars Award program, as well as some of the excellent physicians who spent their entire lives dedicated to communities or to practices, it brings a tear to your eye to watch those students hear those stories and understand that that could be you. What we can do, I think, as a society, in physician society at least, is to try to figure out ways of reaching to those students so we can get the very best and brightest in medicine. Now you've got a chance to use your dollars to help people advance their careers in areas of service where your alma mater may not touch. It's important to be able to look at all corners of American life as opposed to just what's comfortable and close to home. If you want to make your influence felt nationally, contributing to the American Medical Association Foundation is a wonderful way to do that. We live in a society right now that has accepted over the years the ability to say that one group of folks in our society will bear a greater burden of disease than others. We should say no to that. My dream is to try to reduce healthcare disparities and to make it a reality that all physicians think about how culture impacts medicine.